Dear 16-year-old me.
Dear 16-year-old me.
Dear 16-year-old me.
Please don't get that perm. It's not as awesome as you think it's going to be.
You have to actually practice in order to learn to play guitar.
Whiskey tastes even worse on the way up.
Dear 16-year-old me, there's going to be a new set of Star Wars movies. Don't watch them. They ruin everything.
Dear 16-year-old me. This is where they took the cancer out. It was something called melanoma.
It's called malignant melanoma.
Malignant melanoma.
Malignant? That's not a very friendly word.
You'll be diagnosed when you're 28.
18.
36.
29.
22.
It's a tumor that starts in your skin cells, the cells that give your hair and skin color.
It's not just skin cancer.
Well, it is.
Well, it is.
But not just the...
Cut it out and it'll be fine kind, unfortunately.
It's the kind that you have to catch before it spreads.
Because it spreads so fast.
So fast.
To places like your liver,
Your lungs?
your brain.
Yours will be a really rare kind in your left eye, and that's when you'll find out.
That melanoma can show up on your tongue, the palms of your hands, and the soles of your feet.
Your doctors will tell you you're lucky that you caught it early.
Yours will tell you that you need aggressive treatment.
I'll have to tell you it might take a year of chemotherapy.
And you'll need to do some of the injections yourself.
Dear 16-year-old me,
You're doing okay.
you're strong.
But there are some things I want you to know.
I wish I'd known.
That one bad sunburn before you turn 18.
Doubles your chances of developing melanoma.
That fair skin and red hair means that you're at a higher risk of getting it.
As if ginger people didn't have enough problems.
That you're at higher risk if you've got more than 50 moles.
And if you have a weakened immune system or a family history of skin cancer.
I want you to know the outlook is very good if we can catch it early.
But you have less than a 10% chance of surviving more than 5 years if we don't.
Dear 16-year-old me.
Spend more time with family. They mean everything.
If I had one piece of advice for you, don't start the tanning bed. I know you want a healthy glow, but it's going to double my chances of getting melanoma.
Sunscreen.
Yes, I agree. It's a huge pain in the ass, but so worth it. Please.
Your skin's like an elephant. It never forgets.
Dear 16-year-old me, helping spread this message is how you'll honor Glenna's memory. At 16, she's already an incredible lifeguard. She loves the sun and the beach and tanning, but she just doesn't know.
She'll be diagnosed when she's 22 and will lose her battle when she's just 26.
There are 3 different types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma grows very slowly and doesn't spread. It occurs on the face, neck, arms, or hands. It's treated with surgery or radiation. It looks like flesh-colored patches, but is 100% curable. Squamous cell carcinoma looks red, scaly lesions. It grows fast and is 100% curable. Malignant melanoma is less common but most dangerous. It spreads rapidly and attacks other body parts like the organs and bones. It can cause death if not detected early, but has a 95% curable rate if detected early. To prevent skin cancer, while outside, you must seek shade, wear clothing to protect exposed skin, wear hats with wide brim, and also sunglasses that protect against UVA and UVB rays. You must also avoid indoor tanning. Indoor tanning has been linked to skin cancers including melanoma, squamous cell carcinoma, and cancers of the eye. Also, using sunscreen is very important. You should use sunscreen with at least SPF 15 in it. If it does not have an expiration date, the shelf life is usually around 3 years. Some cosmetics contain SPF, but if not, then you should not use them alone and use sunscreen with them. Another way to help prevent skin cancer are self-checks. You should examine yourself head to toe every month. You should start with the head and face, then hands, nails, elbows, arms, underarms, torso, and trunk. Next, stand facing the mirror and use a face mirror to check the back of the neck, back of the leg, etc. Next, sit down and check legs, feet, soles, heels, toes, and nails. You should look for spot or sore that itches, hurts, crusts, or scabs that hasn't gone away for over 2 weeks, an open sore that also hasn't healed in 2 weeks, and any skin growths, moles, beauty marks, or brown spots that changes in color or appear pearly, translucent, or multicolored. You should also look for the ABCD rule. A is asymmetry, when half of the mole does not match the other half. B is border, when the border edges of the mole are ragged or irregular. C is for color, when the color of the mole varies throughout. D is diameter, if the mole's diameter is larger than a pencil's eraser. Every couple months, you should also make a doctor appointment for your doctor to give you a total body checkup to make sure your skin is healthy and stays that way. Also for children, you should ask pediatricians to examine your child's skin at yearly checkups, especially if there's family history of skin cancer or the child has fair skinned. There are different treatments with skin cancer. The first one is surgery, which is just when the tumor is cut out of the skin. And if skin cancer cannot be removed by cutting it out, that is when a person would result in using other treatments. The next treatment is radiation therapy, which uses high energy rays to kill cancer cells. A beam focuses radiation on the tumor. The treatment is much like getting an x-ray, but the radiation is stronger, and the procedure is completely painless. Radiation therapy is often used as a treatment after surgery in the area where the lymph nodes were removed, especially if many of the nodes contained cancer cells. This reduces the risk of the cancer coming back. Some side effects that come from radiation therapy depend on where it's aimed. It might include sunburn-like skin problems, hair loss where the radiation enters the body, fatigue, nausea, or vomiting. Targeted therapy is another type of treatment, and this is just when certain drugs target the mutation in the BRAF gene. About half of all melanoma cases have mutations in the BRAF gene. These mutations cause the gene to make an altered BRAF protein, which results in the melanoma cells growing quickly and dividing rapidly. A type of drug that's used for targeted therapy is Zelboraf, and this drug targets melanoma cells with the BRAF gene. It causes the tumors to shrink in about half of the people who have this mutation, and it also prolongs the time before the tumors start growing again and helps some patients live longer, although the melanoma usually starts growing back again eventually. The most common side effects for this are joint pain, fatigue, hair loss, rash, itching, sensitivity to the sun, and nausea. The next type of treatment that's used for skin cancer is immunotherapy, and this stimulates the body's immune system to recognize and destroy cancer cells. And this drug is given in an IV usually, and it is used for patients with melanoma that can't be removed by surgery or that have spread to other parts of the body, and it has been shown to help people live an average of several months longer. Some side effects that come from this treatment are flu-like symptoms such as fever, chills, aches, severe tiredness, drowsiness, and low blood cell counts. Another type of treatment that can be used is called imiquimod, and this is a drug that is applied as a cream, and it stimulates an immune response against skin cancer cells. It is FDA approved only for superficial basal cell carcinomas and has cure rates generally between 80 and 90%. And then the last type of treatment that's used for skin cancer is chemotherapy. and this uses drugs to kill cancer cells. The drugs can be injected into the vein or taken as a pill. These drugs travel through the bloodstream and kill cancer cells that have already spread beyond the skin to the lymph nodes and other organs. And because chemo drugs attack cells that divide rapidly, it affects other cells in the body, such as those in bone marrow, the lining of the mouth and intestines, and also the hair follicles. Because of this, the side effects include hair loss, mouth sores, loss of appetite, nausea and vomiting, diarrhea, increased risk of infection because of the few white blood cells, easy bruising or bleeding from too few blood platelets, and fatigue from too few red blood cells. And that's it for skin cancer treatment.
Skin cancer develops primarily on areas of exposed skin, including the scalp, face, lips, ears, neck, chest, arms, and hands. But it can also form in areas that are rarely seen by the light of day, such as your palms, beneath your fingernails or toenails, and even your genital area. Most often, squamous cell carcinoma occurs on sun-exposed areas of your body, such as your ears and hands. Most people with darker skin develop the squamous cell carcinoma on areas that are often exposed to the sun, such as their legs and feet. Squamous cell carcinoma may appear as a red bump with a scaly encrusted surface. Melanoma can develop anywhere on your body, and otherwise, normal skin or existing moles can become cancerous. Melanoma most often appears on the head or neck of affected men. In women, this type of cancer develops on the lower legs. In both men and women, melanoma can occur in skin that hasn't even been exposed to the sun. Melanoma can affect people of any skin tone. In people with darker skin tone, melanoma tends to occur on the palms or soles. Signs of melanoma include a large brown spot with dark speckles, a mole that changes in color, size, feel, or that bleeds. A small bump with irregular borders and portions that appear red, white, and blue can also be a sign of melanoma. Kaposi sarcoma is a rare form of skin cancer that develops in the skin blood vessels and causes red or purple patches on the skin. Kaposi sarcoma mainly occurs in people with weak immune system, such as people with AIDS, and people in taking medication that suppresses their natural immunity, such as people who've undergone organ transplants. Merkel cell carcinoma is another form of skin cancer that causes firm, shiny bumps to occur just beneath the skin and in hair follicles. Merkel cell carcinoma is usually found on sun-exposed areas like on the head, neck, arms, and legs. Melanoma is the second most common form of cancer in young adults 15 to 29 years old. The American Cancer Society estimates that 11,590 people died from skin cancer due to malignant melanoma, which is among the fastest rising cancers in America.